Ronnell Nolan, President, CEO, Health Agents for America, coming to you live from the HAFA office for our Monday news. I thought it appropriate with football season and the Saints playing tonight that I wear my Saints gear, my Saints jersey. I know a lot of you had teams that played this weekend, played Saturday, Sunday, and some of you Louisiana fans are going to be pulling for the Saints tonight. So hopefully you're having a good time and ready for some football season and maybe a little bit cooler weather. Our hearts and prayers go out to those that have been affected by the hurricane, and we continue to keep everyone in our thoughts and our prayers. I wanted to reach out to you about an agent advisory board. It's something that Louisiana's Commissioner Donlin created several years ago, and I would like to see this created in other states. So if you have a good relationship with your commissioner, if you could reach out, maybe include me in the conversation, and let's talk to them about creating a board for him or her to be a boots on the ground kind of team to provide feedback, to let them know what's exactly going on, and how we can best help them and how they can best help us. So it's kind of a goal that I've had for a while, something I'd like to do. So please reach out to me, let me know if that's something you think we can do in your state, or if it's done in your state, to make sure that HAFA has a seat on that board. Very important that we stay connected on a state level. Medicaid expansion, that's something that was expanded in some states and not in all states, but I thought it was very interesting. I just read that a Brooks study found that new Medicaid patients went to emergency rooms 20% more than before Medicaid expansion. Now, the whole idea is to give folks who didn't have insurance to have insurance, so they didn't go to the emergency rooms, so they went through the traditional path of going to the doctor. This is obviously not happening, so I thought that was kind of a tidbit I wanted to share with you. Another thing that I think that you would find interesting or important is the provider fee. And that was the fee that was included in the ACA to set up and fund the state and federal exchanges that Congress voted last year to suspend. It would cost the insurance industry about $15.5 billion with a B if it goes back into effect next year, according to an IRS analysis. So, of course, the insurers are absolutely opposed to the tax, and they warned that the tax would cost the consumers an increase in premiums of over $7,000 over the next decade for families that are getting coverage through small employers. So that's important to know, that even though it appears to be coming through the individual channel, it trickles down and affects our employer group clients, small employer group clients. 2017 study by researchers of the Urban Institute found that the median of monthly ACA premiums was about $451 with areas with one insurer, compared to just over $300 in markets with 3 to 5 insurers, and $270 in those with 6 or more insurers. So, of course, competition is important. I'm not sure what we could really do to help bring competition to our states, but if that was something that we could spearhead, and if you have any ideas, that would be wonderful. But the more competitors we have in a state, it absolutely brings the rates down. There's the Medicare D Part D tool. You go to Medicare.gov, and you may want to help a consumer, a client, a family member put in their drugs and find out if and what plan is best for them. I know I do it for my family. Well, that tool has been changed. Some say it's been changed to our detriment, that it is it's bad for agents. Even some folks that I know that work on a state level have talked about the fact that it's not really user friendly. It comes as a surprise, and why are we messing up a good thing? I just question the federal government and some of the things that they do and why they do it. But in the Monday News, you will find a PowerPoint that was put together by CMS to help you understand this new tool. But I encourage you to go and check it out. What I heard is it does have a few bugs, and those bugs are being worked out prior to open enrollment. But be aware. So if you are someone who works in the Medicare industry field, or you just go on there periodically to help folks, you need to know about those changes. Big topic is surprise billing. We used to refer to it as balance billing. I did a report for the Louisiana Healthcare Commission last Friday about all the bills that have been filed. The one that we've been following the most being the Lower Healthcare Cost Act, but several that are out there that are being filed separately. What we're hearing from Washington, and we can only hope and pray, is that the Lower Healthcare Cost Act, while it has about an 80% prognosis of passing, that it will dwindle down to something about just surprise billing and maybe a couple of other things. Take out Section 308 and some of the other pieces and parts, because it's so huge and so massive. There's definitely intense fighting on the mechanics of surprise billing, but everyone agrees that the consumer should be held harmless. The huge fight is over payment situations between the insurer and provider. And for those members that have sat on boards and council commissions and groups that have talked about balance billing and talked about surprise billing for many, many, many years, it's a big issue and a big fight between the insurance companies and the doctors, and consumers are always in the middle. They're always the one who loses. Senator Cassidy, our friend in Louisiana, launched the surprise billing discussion last September. So he's kind of been the spearhead, the leader of this discussion. And he has a bipartisan bill aside from the Lower Healthcare Cost Act, along with Senator Maggie Hassan out of New Hampshire. And they've both been talking to each other and working on their separate proposals, but they don't have an estimate of a date to release the new versions. They're going to have new versions. Cassidy's draft would cap the charges for an out-of-network treatment at about 125% of the median's regional rate for the same services. Maggie Hassan's proposal would leverage independent arbitration to resolve final payment disputes between the provider and the insurer. Now, what I've learned from talking to insurance companies is they do not like arbitration. The doctors do like arbitration. So the insurance companies have said, okay, we go to arbitration, the bill should be $10,000. In arbitration, it ends up being $1 million. They don't want to get to that point. They would rather have some type of cap. And Cassidy said in the Modern Health magazine recently that he thinks everybody recognizes that rate setting is a two-edged sword. That if done poorly, one group might use it as a ceiling and one might use it as a floor. And Trump vows to end surprise billing. So this is a key thing that's on everybody's minds in Washington. And I know you've probably seen it on Facebook, Twitter, LinkedIn. There's different groups that are lobbying to be included, be excluded, have their voice heard on how they would like to be treated with regard to surprise billing, especially those in the ambulance and air ambulance field. Some good news, I guess, is that Highmark out of Pennsylvania is released their commissions for 2020. So if you work in that field or you sell in that state, it's going to be a $20 PMPM for new contracts 2020 and a $10 PMPM for contracts, renewal contracts. So good news anytime we're getting paid, bad news when we're not getting paid, and those are the things that frustrate us. Open enrollment training is open. Make sure that you click on that you're returning agent, so you use the shorter training allotment, then go through the whole process as if you were a new agent. Trish Freeman, our chairwoman of the board, said it took her about 10 minutes. I'm going to say I must be a big goofus because it took me way longer than that. I think I had some computer issues, but it took me a little bit longer than 10 minutes to get that done. But I did do it. I did go through it. So make sure to do that. Do not wait to the last minute. Everybody's going to be trying to do it last minute. There's going to be computer glitches. There always is. There's a lot of people trying to utilize a program at one time. So take a few minutes, end of the day or on the weekend, and go ahead and knock that out. I know a lot of you work in the Medicare Advantage industry, and you're also doing all of your training that is intense and long. But of course, there is guaranteed commissions in the Medicare Advantage, and as we talked about in the summit in Fort Worth, 15,000 people are turning 65 every day. If you do not work in that field and you do not want to work in that field, at least partner with someone, partner with a HAFA agent that will take care of your clients, because you want to have a smooth transition. You want to make sure that they are continued to have someone take care of them. They could be leaving a group program. They could be leaving an individual program, but make sure that there's a smooth transition and they are taken care of. Some really good news for navigators, not so much for agents, is that there's $10 million being given out to 34 organizations across the United States. Imagine what they could do with $10 million if they gave it to the agents and brokers who are licensed and educated and are helping consumers, and those that are not being paid in their state by insurance companies. Wow, wouldn't that be just a wonderful surprise? Texas is leading the amount by 1.5 million, followed a close second by Florida, who's getting 1.3 million. So again, the what do you call it? They're doing reporting, they're doing testing. The number of people that are being helped with the Navigator dollars is minimal, but they continue to churn out those dollars and continue to give those to the Navigator programs. A little frustrating, but it is what it is. Agencies have issued guidance on the impact of drug manufacturer coupons on the ACA's out-of-pocket limits. So this is something very important. The Department of Labor, the IRS, and HHS have issued frequent answered questions whether drug manufacturing coupons for name brand drugs should be counted toward the annual cost of sharing under the ACA, including situations where there's no medically appropriate generic drug available. Drug manufacturers may be counted toward the ACA's annual limits on cost sharing, effective for plans 2020. Non-grandfathered group health plans and insurers are permitted to exclude the value of drug manufacturers' coupons for brand name drugs from counting toward the ACA's annual limit on cost sharing when a medically appropriate drug is available. However, they did not discuss the application of coupons for brand name drugs when a generic equivalent is not available. So there's still a little bit of questions out for this issue, but this was the Wagner Law Report that put this out, and it's in your Monday morning news. So pay attention to this. This is something important. You're seeing all these drug coupons with GoodRx, or I had a scenario with my mom having some eye problems. I drove her to Mississippi, a couple of hours away, was the only doctor that did a procedure. He prescribed her medication that was $500 a month. Medicare didn't cover it, and I called the manufacturer, and she was able to get the drug for free with financial assistance. So this is happening a lot. I encourage you to reach out for your clients. If they have a high deductible, they're on one of these huge cost drugs, and seeing if they can get them with a copay or for free. But this kind of gives you some direction on how that's going to work with their ACA plan. I'd love to hear from you on any issues that's going on with your clients, anything that you might need HAFA's help with. Know that we might not know all the answers, but we do have a seat at the table. Most tables, we know who to go to. My most recent issue was a lady who lost her tax credit. And if you look at her application, number one, it says on that date that the agent and broker made a change. Now, I've been asking CMS for several months now and bringing this to their attention that we didn't touch it. I've talked to several agents that has this on their applications too. We didn't touch it. That was the day they took their tax credit. This particular lady, it said that they sent the letter and they took her tax credit the same day, saying they needed additional information on her income. Now, her income that was uploaded was a letter from her employer, from the her retirement program, outlining exactly what she was going to make. But she didn't get the letter. No one got the letter saying they needed more information. And the letter was sent the same day that she lost her tax credit. So CMS says absolutely you can go in, you can, apply for tax credit for the next month, upload additional income information, and she gets her tax credit back for the next month. That makes a lot of sense. However, if you have the same plan, say she has Blue Cross Blue Shield of Louisiana, she has to pay that entire premium of $1,100 where she was paying $0 in order to keep her coverage, in order to get the tax credit the next month. Now, what I can't get CMS or anyone in Washington to understand is if I am poor and I am getting my insurance for free, it means that I live paycheck to paycheck or retirement to retirement check in this instance. I do not have $1,100 to pay for 1 month. Now, they don't give tax credits back. You can appeal. I've had a lady appeal. They charged her 2 months because she was on auto draft, the full premium, limited budget, just happened to have some money in for renovation of her house. They took all her money. I mean, we can't have this. I'd like to hear if this is happening to you. This is maybe something we need to bring to Washington, to our legislators, to our congressmen, to our senators, that those of our clients that are on a limited income can't afford to pay full premiums. People over 400% of poverty cannot afford to pay full premiums. So why do they think someone who's on a limited budget can pay full premiums? So a little fired up, a little excited about this that just happened on Friday. But until next time, know that I'm here. Know that I'm basically a one-man shop. So if I don't answer an email right away, please send me a follow-up. It just means I missed it. Or text me. If you call the office and I'm not here, I'm out and about. So just make sure that email is probably the easiest way to grab me, or text me, whatever. If it's really important and you need me right away, feel free to. But until next Monday, fourth quarter's here, open enrollment, Medicare, individual marketplace is right around the corner. So keep the faith, keep trucking, keep doing what you do, and which is the right thing. And I'm proud and honored to represent Health Agents for America.